Chief of the Auburn Fire Rescue Department. So much has changed in the past 2 decades with how we deliver emergency medical services to our communities. Advances in technology have brought us better personal protective equipment, safer apparatus, training, and greater diagnostic tools and equipment that better help us diagnose serious, sometimes fatal medical problems in the field. Many fire departments across the nation have absorbed EMS into their operations over the years because it makes sense. Whether it's for better operational control and communications, or greater oversight of staff and their training, fire-based EMS provides so many opportunities for increased efficiencies and provides much-needed staff for responding to both fire and EMS emergencies. In this video, we want to show you the time and effort that goes into handling a medical call. What you are about to see is a simulated emergency medical call for a person complaining of chest pain. You will see the same call handled with 2 EMS providers, 3 EMS providers, and 4 EMS providers. A time-elapsed clock, in addition to picture-in-picture screens, will appear so you can track the movements of the EMS providers, as well as their on-scene times. Let's hear now from Captain Eric Otterson of the Auburn Fire Rescue Department and our Medical Director, Dr. Mark Restuccia from the University of Massachusetts Medical Center, who will talk to you about modern-day EMS and provide some narration for you during the simulated call.
Come in.
Fire department. Hello. Call
Yes,
the
sir.
ambulance?
Yes, sir. He's upstairs.
Okay, great. Hello there.
Hey.
Not feeling too good, huh?
No, not
So
today.
when did this start happening for you?
So I took a nap earlier today, or this afternoon, and woke up and...
So I think what's important to note here is top left is the 2-person ambulance crew, a paramedic and a basic EMT. Bottom left is going to be the same ambulance crew augmented with an engine response. And then top right is going to be same ambulance crew augmented with 1 additional firefighter in a like we call it a fly car, which is a department vehicle which responds along with the ambulance. So initially, when the crews enter into the patient's residence, they encounter the patient, introduce themselves, and what you're seeing here is the overall history of present illness. Why exactly they called the ambulance, how long has this been going on for, what's aggravating, what's making it worse, what's making it better, has this ever happened before, what do they take for medicines, what they had to allergies for medications, what they have for other comorbid medical conditions which could further complicate our treatment. And also parts, it goes hand in hand with the physical exam. Initially here you can see blood pressure acquisition, pulse, respirations, pulse oximetry, all happen at the same time, and all that information is compiled to come up with a treatment plan. And so that's what you're seeing play out here. Also, you see assistance with putting the patient on our EKG monitor, and a bunch of wires that you see that are being placed. So there are a total of 10 different leads, and it gives us rate and rhythm, and it also gives us 12 separate views of the patient's heart, which allows us to, and we use certain criteria for diagnosing if they're having an acute myocardial infarction. And using that information, we can notify the hospital and ready the appropriate resources at the hospital. Patients are also placed on oxygen if needed. That's depicted by the green bag. This patient did require oxygen, so he was placed on that as well. Other things to point out are also there are extrication devices, patient extrication devices called the stair chair. It's a funny looking device that you see off to the right in the screen in some of the shots, which is used to extricate the patients down narrow stairways. I think, Dr. Astucci, you can probably allude to patients not exerting themselves in the protocols when they're having any type of chief complaint, such as a heart attack or shortness of breath.
Sure. It's good medical practice and actually mandated by the Department of Public Health that a patient really should not be allowed to exert themselves. Things like strokes, heart attacks, doing extra exertion on their part to assist in moving themselves out could make their condition worse. The other thing that you look at, so they're all doing good care, they're all doing mostly the same things, but when you've got the augmented crews, either with the one extra person or the full engine, you've got the paramedic basically focused on the patient. He, or if it was a she, is not being distracted by things like having to set up the stair chair or get equipment. They can focus entirely on the patient. They can get a better history that way. They can reassure the patient. They're not being interrupted to do other things. It means they're not going to forget critical parts of the history because all they have to do is take care of the patient. They don't need to do any of the ancillary stuff. So that's actually a tremendous benefit for both the patient and the treating paramedic.
And I think that it's important to note that because when this patient goes, one of the things the video doesn't show is when we eventually leave the scene, the paramedic is the one who will be rendering further care, monitoring the EKG monitor, vital signs, repeating that, giving entry notification through Worcester CMed to the receiving facility, and also talking with the doctor, physician, and also nursing staff at the hospital of what's going on. So it's just it's good patient care, like you said, and very appropriately alluded to. The treating paramedic, or in other types of chief complaints, one of the EMTs could they're focused on the patient. And with the extra set of hands, we talked about decreasing anxiety further by not being focused on other matters that pertain to the patient, extricating other types of procedures. You're allowing yourself to focus on questions the family may have, spending time with them, explaining what you're doing. Whereas if you're tied up with the basic function of your job, providing the care and extricating them out, that gets shortchanged a little bit.
The other thing you'll notice is, as I alluded to earlier, the history and the environment the patient's in are critically important, or can be critically important to me in the emergency department, and I have no way of knowing anything about that. If you've got just one or two people there, they're so focused on doing the mechanics of getting the patient packaged and out the door. They may miss historical factors, they may miss environmental factors. I've had paramedics and EMTs come in and say, gee, this person looks fine, doc, but the home environment's not safe. There's no heat, there's no food, it's a mess. If you've got sufficient personnel to be able to focus on things like that and not be distracted by the actual just moving the patient, it is a critical piece of information for me. We've had to have people admitted to the hospital because we couldn't safely send them back to their home environment. So having sufficient resources on scene to be able to notice that and tell me that is hugely helpful.
Absolutely, and that's a great point. And I think we've reached a critical moment in our videos here. You can see bottom left, top right. Bottom left just disappearing. The patient's already been transported to the hospital. Top right is getting ready to go to the hospital, and that's vital for and like you had alluded to earlier, time being muscle.
As we get better at treating things like strokes and heart attacks and trauma, it seems not obvious, but minutes really do count. If you're having a heart attack and you get the person to the appropriate facility quickly enough, we can save enough heart muscle that this person basically can live a totally normal life, whereas if it's delayed, that might not work. Same thing is even true for strokes. The quicker you can get them to the hospital, the better they're going to do. And as you can see, top right, they're now leaving, and really the two-man crew, they are not going slow. They are practicing perfectly good EMS there. They're focused on the patient. There's nothing wrong there, but they haven't even started to put the patient onto the stair chair. And they haven't even started to try and extricate, and these two guys are going to have to try and do that and carry all their equipment out. Not safe for them, not safe for the patient.
Exactly, and again, it's 113 pounds of gear that these two guys are going to split between the two of them, plus the weight of the patient over uneven terrain, down a set of narrow stairs, out onto the front lawn, and then into the ambulance. As the treatment progresses here, may not have been as evident in the other two videos, but you have an intravenous line started by the paramedic and also given some nitroglycerin and aspirin as well.
Years ago, the intent was just to throw them on a stretcher as quick as you could and just drive to a hospital. That's not considered appropriate care anymore. There's an awful lot of history and interventions that even basic EMTs, but even more so paramedics, are expected to be able to do on scene. So there's a lot more stuff going on in the home than ever before. Treatment doesn't begin when you get to the hospital. Treatment begins the second the EMTs or paramedics get to that patient's bedside.
And I think, that's again another great point, Doc, is that we're treating this patient here. We're treating his potential hypoxia or defined hypoxia. We're treating any type of ST elevation we see on the monitor, any type of the symptoms of having chest pain. Giving him some aspirin, giving him some nitro. We're beginning treatment now, and also coupled with rapid transport, which is still very much a part of our job. It just equals the overall betterment of patient care and how, like you had said, outcome.
They're treating the person's low oxygen level. They're giving aspirin, nitroglycerin, which have been shown to improve outcomes. So people do better the quicker you get those things. When you're having a heart attack, you can actually have your heart beat irregularly. Well, they're ready to intervene and break that. This is just state-of-the-art care now.
So once we get him out into the truck, secure it in, you can come back and get the stuff,
Yep.
come back, put the stuff in, and we'll start going.
And you're getting close to
And you see the box on this screen right here, box bottom right, that's actually all of our pharmacologic intervention we call our drug box. That has all of our narcotics and other medicines for arrhythmias, things of that nature. Now, once we begin care, you'll notice that coming down the steps, that monitor is about $32,000, and that's one of our older style monitors. And that's on the patient. They're being continuously monitored, and that information is being stored in this machine, so we can give it to the hospital upon arrival. You can see right there that it's remaining on. So if he does have an event, if he has some sort of an arrhythmia, it's captured by that monitor, and we can report it to the hospital. And I'm sure you've seen in your practice in local emergency rooms, is they will not at times. They'll go to the hospital and they'll be perfectly fine. Whether they were feeling weak, they were feeling dizzy, you couldn't feel they're having some chest pain, they thought their heart was beating funny, and if they were to drive themselves in, they weren't sure. If you didn't have that pre-hospital EKG, you wouldn't be sure of what happened. But if you have that continuous monitoring and you actually see on our EKG, then you can actually say, oh, they had this potentially fatal arrhythmia.
Well, I've had patients come in, and by the time they got to the hospital, with all the appropriate interventions, their EKG is better, their pain is gone, but because the paramedics have gotten a pre-hospital EKG which shows changes which are concerning for a heart attack, we know that we need to take them to the cardiac catheterization lab right away because they're at risk for having a heart attack very quickly. It's only been stopped by what the paramedics did, but they're still at risk, so hugely helpful. I know somebody's going to comment, well, how could he even look at the monitor while it's on his back? All of these things have alarms so that if the patient's rhythm or vital signs change, they'll alarm so the paramedic knows right away to treat it.
Absolutely, and this is something we can even print a code summary at the end, and these with our electronic patient medical records now, these get through Bluetooth technology through the internet, they get linked up to the patient's record. So once they're in our system, we actually have old EKGs of all of them that were done pre-hospitally as well. And again, you can see going over uneven terrain here, a little bit more cumbersome and also dangerous for the providers. You can see there's a lot of lifting and carrying. Back injuries are a big problem in fire-based services and EMS in general, all over EMS. Lifting and moving. You can see that that's a big lift right there, and this is this tends to not be a very heavy patient at all. So we have the patient in the back of the ambulance with the two-person crew, continuing care. We still have a lot to do as far as getting all the rest of that equipment out of the house locked up, things of that nature.
Yeah, you'll notice that when they removed the patient, they had to leave a significant amount of their equipment, including their drug box, upstairs in the patient's room. So, sure, the other EMT is going up to get those things, but it's all delaying care.
You sitting on it?
I hope this video demonstrated the tasks that need to be performed and the physical ability and exertion needed to handle a call in a timely manner. One of the more frequent questions that departments across the country get is, why does a fire truck follow the ambulance on calls? This video showed that need. As Captain Otterson pointed out, we are no longer ambulance drivers. We are highly trained medical professionals delivering cutting-edge pre-hospital medicine. As you have seen, in order for that to be done in a highly effective and efficient manner, with good on-scene times in mind, it's labor-intensive. Thank you for watching this video, and for more detailed information regarding this study, including additional commentary, visit our website at auburnmassfire.org. Click on the Educational Materials link and read the full white paper report. Thank you.